and welcome to another exciting episode of the MolarBear. Today we have a pleasure of hosting Dr. Anukrati Srivastava, who secured an impressive All India rank of 97 in NEET MDS 2020 examination. Dr. Srivastava completed her BDS from GDC Jaipur, followed by internship in the same institute. She further pursued her passion by specializing in conservative dentistry and endodontics, again from GDC Jaipur. Welcome to the show, Doc.
Hello, thank you so much for having me. I would first start this podcast with appreciating you. As a dental student, we are a little cornered, especially as a first generation dentist. So your podcast is helping a lot of students to navigate through dentistry. So yeah, applauding you for that.
Thank you, Doc. Thank you. And thank you once again to give your time to us and to this show.
My pleasure.
Well, Doc, it's truly inspiring to have you with us. Can you just share with our listeners what inspired you to pursue a career in dentistry?
Okay, so my journey or my aspiration was to become a doctor, like ever since I was a little young girl.
Mhm.
Uh, so I had this small story which has become a little relevant to me now. But I talk about this to talk about the uncertainties of these entrance exams that we give and life in general. So it was year 2014 and I had secured my rank 400 in the state PMT and all.
Wow.
And I got an MBBS seat and everything. And then it was first year in 45, first time in 45 years that exam was to be retaken.
Oh my God.
And I had to give that exam again after a month. And I was away with my friends and family for a month, and then they was like, come back, the exam has to be retaken.
Mhm.
So yeah, I couldn't give it as good a shot as in the first time. And I think that was for one reason, that these entrance exams are actually designed to test how well you can apply what you know.
Mhm.
Right. So, and that can only happen when what you know it's so damn well that you're extremely confident about it.
Mhm.
And that comes from revision. So, that 1 month I was all away and all. So, coming back to me, so I joined GDC Jaipur, and which was a very good college. It was the only government college in Rajasthan.
Mhm.
So I joined it. For the first 2 years were little, depressing. I
Depressing.
wouldn't say depressing, but I wouldn't say depressing, but little uninteresting. I was lost. But during third year of my BDS, that I developed my interest in the clinical dentistry.
Wow.
That's my journey to dentistry.
Doc, did you re-give your exam in 2015 and then you got into dentistry or that exam? What was the story ma'am, behind that exam?
So that exam I gave again, but my rank was a little behind. It was 400 in the first one, and then I pushed to 1000. So I and that exam after which happened one after 1 month,
Mhm.
I got dentistry in that same
Okay,
exam
okay.
after 1 month.
Wow, not bad. So basically, to say that destiny chose you for dentistry, if I'm not wrong, right?
Yeah, I would say that. I would say that. I am very happy about it. So yeah, but it has become irrelevant to me, but it's something anybody can take from these, because these exams are very unpredictable. So
Mhm.
we can't be put all our if this doesn't happen, that's the end to it.
Mhm.
So yeah, that's just the lesson
And
behind it.
yeah, and coming to your achievement, doc, that how did your journey led you to achieve such an outstanding rank in NEET MDS exam? My God, matlab, when I turn upon my Pulse, Dental Pulse, which is the best book for cracking NEET
Yeah.
exam, and the whole world goes around. And first of all, the anatomy, the subject which I hated the most. How did you conquer this?
I would suggest, since exam is in next 10 days, so this is a small portion is for the people who are starting off, and then I'll talk about the people like who've just going to give it in 10 days. So people who are just starting off, I would suggest, like, if you're in third year, just start now, because third year is very uninteresting. There's general med, there's general surgery, there's oral pathology. You are not applying anything you're studying. But when you start preparing for like NEET MDS in the third year, you can actually, use it for applying in questions, in, MCQs. So it becomes a little interesting. But I started my preparation in my internship. So like what helped me was, like, I'll put it into pointers. So first thing was I joined a coaching thing, like a coaching class, for the sole reason that I was a first generation dentist. Like I had no guidance, like how to study, like what are the important subjects. So I joined for that reason, and they actually helped me, like they helped me eliminate what was actually, like what was to be studied, and brought light to what was actually to be not to be studied. So that saved a lot of time, and they actually made a plan, so that helped a lot. Then second three thing would be, like, I didn't burn myself out in the initial months. I was like, I can't, like, study for 15-16 hours in the initial years, but I was regular. I was like, I can't, even if I'm studying for 2 hours, I would keep studying, but I didn't burn myself out in the initial months. I was like consistent, but yeah. Then third thing was I was very consistent with the revision. Like I had this notion in mind that there will come a day where I have to revise 19 subjects in 7-10 days, because last 15 days you can't be like, there can't be any subject that you haven't read in last 15 days, because it has to be revision. So I kept a track, and I was very consistent with the revision. So those are the three things I think I did right.
Wow.
Yeah.
So, as NEET MDS exams are just around the corner, could you offer some valuable tips for aspiring dentists who will be appearing in for
The
this
exam.
exam on March 18? Like how many minutes to give to the questions, how to tackle answers, and all that.
I, as the best I remember, was like I was asked to attempt at least 85 percentage of the questions. That is like the minimum. There in my exam there were 240 questions, and I attempted 224, which was in on the higher side. So yeah, and do it in sections. Like first section is you the that the ones you are absolutely confident about. Then second are the ones which you're question, like you are confused between one or two questions. And then third would be just leave the questions that you don't know anything about. Like just leave those questions, don't go into those questions. So first is when you're done with the like absolute ones, then the questionable ones. Now, how do you deal with the questionable ones is through deduction. Like you have to reduce, like this, like what are the ones which cannot absolutely be the answer. So that's how you do those questions, the deduction ones. And the third ones are the that you don't have to touch. So that's like 85% is the like minimum amount. Then okay, so these last 9-10 days, I would suggest is last year question papers. So like don't just give them, like sit and keep doing it for the whole day. Take proper 3 hours and try to finish them in those 3 hours. Or you can take a grand test, like grand test as in the whole subjects. So what it does is like it increases your that thinking power, as in the sense how fast you have to think, and try to complete them within 3 hours. That is my one thing. Then second thing is your handwritten notes are very important. Like I remember, like when I was giving the exam, I knew where that answer was written on what page. I know this might sound like this is like cramming, like, but this is not cramming, because it's like visual memories that you get. and that can only come from your own handwritten notes. So try and give what do we call it, like a, I don't know, last minute revision to it. Like you don't even have to read it, just go through them like in a second or two. And the third most important thing is the psyche. Like psyche as in, there are a lot of people I've met, like the the fan was not working, my the person sitting next to me was very irritating, my like table was not working. So just enter that exam with utmost interest, like with focus, that those questions have to be dealt with a lot of focus. And like whatever you've read in those last 2 3 years or 1 year, however long you've been studying, just focus on them and bring back to your memory at the moment, because no matter how long you've been studying, but that 3 hours decide. So try to just, I don't know. Like I remember I had a senior, like I don't know if it's relevant or not, but I had the senior who told me like he was in a psychedelic mode when he was in those 3 years. And same was I. Like after 3 hours, I looked up and I was like, I hadn't had water. I didn't care for those 3 hours. Those 3 hours are yours. Like जितना भी juice हम निकाल सकते हैं अपने mind का, just take it all in those 3 hours. Yeah.
No.
I think it's a very long answer.
No, 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 not at all. Thank you for giving your expert advice to our students, basically, or the NEET aspirant who are gonna give a exam. So, guys, please, there, she, her doctor has answered everything in a very clear, very systematic, and in a pointers. Do keep a note of this and do try to follow the pattern which she had followed. And obviously, guys, she's a senior and she must be knowing something, as we all know that in our field experience is only everything, right, doc?
Yeah, experience is like, I think it's one of the things that you have to accept, that you can't go perfect like initially. So experience does help.
Well, doc, coming back again to your life, your dentistry, and your journey. So, why conservative dentistry? Like, there is always a question in my mind that you people also do RCT, you do class 1, class 2 fillings. A normal
Yeah.
person, a normal dentist can also perform these things. So, why did you opt for conservative dentistry? I mean, what is so special about it?
I think conservative is a very graceful like branch, like the delicate, you know, the anatomy, the biomimetic part of it. It's a very graceful branch. So conservative came in, I think, a little late after I started my PG. But initially it was the endo that grabbed my attention, for the fact that during our internship, when you're first exposed to the clinics, and I think that is after oral surgery, conservative and endo is the one thing that you learn something new during your internship. Because before that you're just doing resto, and then internship may you're like, okay, like do now root canals and stuff. So when I started doing my first initial endos in my internship, I found it like very fascinating, because for the same reason that we could bring change to a person's lifestyle, their um, that person is going through something, and that we can bring a small change, and that small change is a big change for the other person. And I found endodontics like very it's very precise and very graceful. Again, it's a very beautiful branch, and you need a lot of patience. And I think the grace and the change that I can make was the thing that grabbed my attention. Then when we started from BDS to MDS, then I started to know that MDS is not in consendo, is not just root canals. Like you're not just going there and opening the tooth and that's it. But there is more to it. There's diagnosis. Like I don't know any other branch that knows as like diagnosis as good as the people who've done their masters in consendo. Diagnosis is you like bang on about pulpitis or whatever other pathologies. So that's one thing that is special, like when we compare it to general dentistry. Then the kind of restorations we were doing in our general during our bachelor's, the kind of restorations we do now in our masters is like very, very different. Then in endodontics, there's regenerative has come. Then we have going to do vital pulp therapy. So it's not just root canal now. It's more advanced than just root canal. So that I actually got to know after like I joined masters. Ki no, it's not just root canal. So anyone who wants to be like wants to do it in endo and is still confused between different branches, or if it's worth it, I would say like it's totally worth it, especially with micro endo coming in, and conservative also has the aesthetic part to it, so it's definitely worth it.
Wow. So this was a part which I also know that endo is so deep. All I knew was Grossman. All I knew was RCT and
Yeah, yeah,
the restoration. और एक चीज़ था that was I don't remember. That was in second year preclinical. Um,
yeah, that class twos and amalgam cavity preparation, I guess
no,
that was in class two.
no, no, something which we used to pick up from a pin. What is inlay onlays? I guess, right?
Oh yeah, we do inlay onlys as well, like
Yeah, I have never seen
yeah, we
it in
do
my
inlay.
whole career. All my career is very young right now, but inlay only is
Yeah.
awesome. Hmm.
But actually, like the we are taught cast metal inlay onlays, but like now we do like ceramic inlay onlays. So it is a little different, but the anatomy and the whatever you're learning, the preparations, it's quite similar to that. I won't say like it's a complete different, but yeah, the ceramic inlay onlays are same. The biomimetic part is going. So a lot of my juniors and my batchmates, they were doing that's still doing learning in onlays in their PG.
Okay.
Even I learned during that time.
Wow. Well, doc, transitioning from BDS to specializing in conservative dentistry and endodontics must have come with its own set of challenge. So, can you tell us about some of your struggles which you faced during your PG time and how did you overcome it?
Struggles would be first. Struggle was like one of my seniors when I was starting off. And I had like issues during the first year, because first year is one of the most where the transition actually happens. So he told me that PG, like residency or postgrad, is all about performance under pressure. Like you have to listen to everyone when you're in your first year, from seniors to staff, to paramedical staff, to professors, to HOD. You have to listen to everyone while doing your own thing. So like while being focused on what you actually came here for. So that was one thing, that staying focused and performing even while under pressure. Second thing, that the struggle was the multitasking, like multitasking as in there are 100 things going at once. You have to do your pre-medical, like preclinical work. You have to go see the OPD. You have to prepare for your thesis. You have to do multiple things all at once, and which makes a lot of people very panicky and anxious. So yeah, and then that dealing with that, just keeping your calm and then planning things out. So that was one of the struggles. Then during, I think one struggle which I faced from transitioning from BDS to MDS was during our BDS, we were just reading, right? This is like reading. This is all we know. This is all we know. But as you move on to masters, like whatever you're doing, you'll be questioned. Like, okay, so this was your treatment plan. Why did you choose this treatment plan? So it increases your, like, it pushes you to think a lot more than you actually did. Like they in MDS, you can't be just like कि ऐसा book में लिखा है तो I did that. In MDS, you have to give an evidence based, evidence backed up answer कि like this is the research that's going on, and this is the best treatment plan that I could give to the patient. So that was also a struggle, but I can't say struggle. That was actually something that pushed you to be better, or pushed me to be better. Yeah.
In short, how did you manage time? I always see my friends, my colleagues, they are
Mm.
struggling for time in PG. Actually, you told like OPDs, patients, thesis, this,
Mm.
that. How did you manage your time during those days? Like
Okay,
certain
so
set of timetable which you used to follow. Matlab, I have seen people not sleeping for 1 2 days doing their work कि आज हमारा LD है, आज हमारा thesis presentation है and what
I
not.
see. Yeah, that's true. So we had this week of like, this is the day for that, this is the day for that, and we had like a proper what do we care schedule. So we have to be prepared, like on next Monday I have to give a journal club presentation or an article presentation. So I had divided days, like on Monday I'm going to do this, on Tuesday I'm going to do my special cases, on Wednesday I have OPD, so I'm not going to, I'll be looking for these cases in the OPD. Then Thursday I'm going to do my thesis cases. So every day of the week was divided into something or the other. Like, then after final year comes, then you have to do the exam cases. So then I dedicated one day of the week to exam cases. So that helped, like initially, like when you start like with your appointments only, like and your, I guess, end of the first year you start giving appointments. So then like, then only decide that this is the day that I'm going to give to my regular OPD patients, this is the day I'm going to do my special cases, this is the day I'm going to do my surgery. So that helped. Then also one thing that helped during my master's planning was I had made a list initially. Like when I started, I helped with the help of my seniors. Like, what are the special cases that we look for in the OPD? What are the special cases that we're supposed to do? So once we know that what are we looking for, like if there's a special case on hemisection, so I will know that I have to look for tooth width furcation involved, or if there's a pre notion in the mind that this is what we're looking for, that also helps. Then also, like, one thing I would like to tell people is like, PG is not something that you do on your own. Okay, PG is a collaborative process with your seniors, with your juniors. Like, nobody does it on your own, because when even a senior is doing something new, you have to dedicate some time to that, to learning that, because there's not 100% chance that you will be able to do that particular case in your 3 years of tenure. So if I know that some senior is doing something new, I will put out some time key, we call boss our senior. Ki, you just tell me which day you're going to do that case. I will keep my 1 or 2 hours free. Same goes when when your junior is doing a new case, right? So I used to tell my juniors also, if you are doing a new case, just let me know, because 3 years is not a very long time. You have to adjust a lot of things in that period. So try to learn from your juniors also, your seniors also, from everyone, like how much ever you can.
Well, Doc, looking towards the future, what are your aspirations and goals in the field of dentistry? Do you have any specific plans or project that you are excited to pursue?
I actually, like, after endo, there's one thing that excites a lot is aesthetic dentistry. So I looked up a lot of fellowships in aesthetic dentistry, and like aesthetic dentistry, like, is more like doing on your own, like what you can do on your own. So I figured that, once I open my own setup, I have some incoming patients that I can actually perform those aesthetic uh, cases with. So then I can apply for fellowship. So one thing that I'm looking forward to is my fellowship in aesthetic dentistry and microendodontics soon. Like right now we just you using loops and stuff, but for microscope you need proper space, you need proper equipment. So those two things that I'm looking forward to soon.
Yeah. All the very best for your future endeavor,
Thank
Doc.
you so much.
And finally, coming towards the end of the show, as a message to the young dental student who might be listening to us today, what advice or word of encouragement would you like to share with them as they embark on their own journey in the field of dentistry?
Okay, so again, 2 points. Number one would be like initially when we start off with cases, no, we try to fall for perfection. So there's, especially in endo, like you can't perfect like on the first go. When I started off with the simple case of these MTA apexifications, I used to make such ugly plugs. Okay, and I used to beat myself up like, what kind of plug is this? It's not, it's not consistent. It's like there's spaces. So initially I would say don't fall for perfection, okay, because when you're starting, like doing is much more important than doing it perfectly. And we put this very unrealistic expectations upon us and then feel guilty that we're not living up to it. So don't put up so much expectations. Just doing is more important than doing it perfectly. That's one thing. Second thing is, like I was talking to my senior today and I was like, what is that one thing you would, give to your younger self? And she said that giving best every day, like, and don't rush for results. That is one thing, because results will show on up, like eventually show up on their own. Like when you start your first direct composite, it's same. It's not going to be that great, but the best you did today will be useful for your, one or the other day. It will come up. So do your best every day without thinking of the result, like how good you can do. So that's my second thing.
Well, thank you so much, Doc, for sharing your insights and your experience with us today. Your journey is truly inspiring, and we wish you all the very best for your future endeavor. Thank you for coming to the
Thank you
show.
so much. Thank you for having me.
Well, I'm your host, Dr. Ganendra, and as we wrap up this insightful session, I encourage our listeners to connect with us on social media and keep an ear out for upcoming episodes of the MolarBear. Stay engaged, remain inquisitive, and continue to share your wonderful smiles with the world. Thank you for joining us today. Bye bye.